Okay, so we're getting a lot of questions about where to put vaginal estrogen. Where does it need to go? How much do you need to use? Does it need to go on the clitoris, on the labia, just in the vagina? And this is really good questions, and I love the nuances and all of the questions. But on the very fundamental level, any vaginal hormones are better than no vaginal hormones. So if you're getting urinary tract infections, you have dryness, you have pain with sex, some vaginal hormones are better than no vaginal hormones. And now there's the next level of like, well, where do I put it and how much and what dose do I do? Am I on the perfect regimen of vaginal hormones? So there's a lot of nuance here. So let's get into it. So there's the vagina, which needs to be acidic. It needs to have healthy bacteria so that it can fight infections, especially urinary tract infections and vaginal infections. So we, in our office, we use pH paper to make sure the vagina is acidic enough. Now you can buy pH paper on Amazon and you want it to be able to pick up a pH of 4.5 to 7.5. And if your pH is 4.5, then you're doing great with your vaginal hormones, or maybe you don't need vaginal hormones yet, but it wouldn't be dangerous to be on them. Now, if you're just taking a hormone cream and putting it on the clitoris or on the labia, it is unlikely that that's going to be enough to acidify the entire vagina. So sometimes we will say the first job that you have is to acidify the vagina, get the pH to be 4.5, and so we know that you are optimized to prevent urinary tract infections. So how can that be done? Well, we have lots of videos of all the different options. So you can do a vaginal insert, that's like a twice a week tablet. You can do a suppository of DHEA, that's every night. You could do a vaginal ring that stays in for 3 months, or you can do a vaginal estrogen cream, which I recommend rubbing in really well into the walls of the vagina so it's not messy or goopy or gloppy or anything like that. So those are options to get the vagina acidic. Now, if you're noticing pain at the vulvar opening or around the urethra, or the clitoris seems to have decreased in size, or your labia are disappearing, well, we don't have amazing data to show that we can make all of that come back or help all of that. But we do know that those are hormone-sensitive structures. And it may not just be an estrogen story that estrogen cream will fix, but it probably will not hurt these parts of your body. There may be some benefit of using things that have androgen or testosterone into them, but we don't have unlimited data or guidelines to sort of guide us there. So you may want to work with a clinician who's a little savvy who will help guide you through what to put externally on the genitals. But if you had an estrogen cream, like we just talked about, and you wanted to put that on your labia minora or on the clitoris, it would not be dangerous or harmful because we know that there really isn't whole body systemic absorption to using these creams. But what's so important is that you don't use it on the clitoris and the labia instead of putting it in the vagina. So we'll have patients who don't like to put creams in their vagina because they're messy or goopy. So they will put the tablet inserts or the DHEA suppositories, and then they may take a cream that has estrogen in it or estrogen and testosterone, which we have to have compounded because we don't have a product. And we will put that at the area around the urethra or the opening to the labia to help support that tissue. This is where a physical exam is so important. If you're doing all of this through telemedicine or your doctor's not examining your vulva at all, well, then how are they going to know where to apply these different kinds of medicine? And if your doctor doesn't know this, show them the video and maybe this will help them kind of be curious or interested. Most doctors don't get taught how to do a vulvar or clitoris exam. And so we're trying to teach that and to get more data and to teach people how to do this. We have a group of students working on research just on the labia minora alone. Science has completely ignored it. So of course we don't have overwhelming guidelines here because we're still just starting the basic science research. So I hope that helps. If this is confusing, it's because we don't have all the answers, but we have a lot of questions. And when we have questions, that helps us figure out how to find the answers. Thank you so much.